You know, when we usually think about body fat, there's this tendency to view it as like just inactive storage.
Right, like a biological attic.
Exactly, an attic. Just a place where the body tosses extra calories to, deal with later. It just sort of sits there taking up space and collecting dust.
Yeah, that's the common perception.
But when you step into the world of oncology and metabolic health, that image of the passive storage attic just completely shatters.
Oh, absolutely. It's fundamentally incorrect.
Right, because we are actually looking at a landscape that is highly active, incredibly complex, and honestly a little alarming. So, welcome to the deep dive.
Glad to be here.
Today we're exploring exactly how that biological landscape changes when we introduce a very specific type of physical stress.
And it's a fascinating shift to see.
It really is. For you listening, we're going to be unpacking a rigorously detailed 2024 paper to establish the academic foundation of our exploration today.
Yeah, it's a very comprehensive study.
It's published in the Journal of Sports Science and Medicine, and the full title is, bear with me, it's long, combined aerobic and resistance training, improves body composition, alters cardiometabolic risk, and ameliorates cancer-related indicators in breast cancer patients and survivors with overweight obesity. A systematic review and meta-analysis of randomized controlled trials.
A mouthful, but very descriptive.
Definitely. And this was authored by Samir Badri, Al-Mhanna, Alexios, Batrakoulis, and an international team of researchers.
Right.
So our mission today is to unpack exactly how combining cardio and weightlifting, which we're just going to call CART to save time, how CART physically, chemically, and psychologically alters the bodies of breast cancer survivors who are struggling with excess weight.
What's fascinating here is the sheer scale of the data we're looking at. I mean, the researchers didn't just conduct one small experiment.
Right. It's a meta-analysis.
Exactly. They pulled together 17 different randomized controlled trials, or RCTs, and that involves 11,148 female patients with a mean age of 54.
Wow. Over 1,000 patients.
Yeah, so we aren't just looking at a snapshot. We're looking at this highly synthesized mosaic of how this specific demographic responds to a very specific type of exercise protocol.
Okay, well, let's unpack this. Because before we even talk about the exercise itself, I feel like we need to understand the stakes for these 11,148 women and really the millions like them.
The stakes are incredibly high.
Yeah. Why focus specifically on breast cancer survivors with overweight or obesity? To go back to that opening thought, if fat isn't just an attic, what is it? I like to think of it instead as a rogue endocrine factory.
That is a very accurate way to put it.
Right. Like, it's not just sitting there. It's actively pumping out inflammatory factors and adipokines. Yeah. It creates this toxic environment in the body where tumors can actually thrive.
And the clinical reality presented in the paper backs that up in a very stark way. I mean, breast cancer is the most frequent cancer in women globally.
Yeah.
And the data shows that roughly 25% of these cases are directly linked to excess weight and a sedentary lifestyle.
25%. That's huge.
It is. And the issue absolutely does not end once the initial cancer is treated. Obesity affects 1 in 3 breast cancer survivors.
Wow.
And this significantly raises their risk of cancer recurrence, as well as comorbidities like hyperlipidemia, which is, a high concentration of lipids or fats in the blood.
Right.
It also increases the risk of sarcopenia, osteoporosis, and ultimately it increases overall mortality.
So the stakes are essentially life and death, even after the initial cancer's theoretically gone.
Unfortunately, yes.
But let's look closer at that rogue factory concept, because you mentioned adipokines and hyperlipidemia. If I'm visualizing this for our listeners, how exactly does having too much lipid in the blood or, these adipokines floating around, how does that actually help a tumor grow?
Well, think of adipokines as chemical text messages sent by fat cells to the rest of the body.
Okay, text messages.
Right. In a healthy state, they regulate metabolism. But in a state of obesity, that messaging system goes completely haywire.
Like spam texts.
Exactly like spam. The fat tissue starts sending out constant loud distress signals, causing chronic low-grade inflammation. And this creates what we call a tumor microenvironment.
Oh, I see.
Now, combine that chaotic, inflamed environment with the hyperlipidemia, tumors are highly metabolically active. I mean, they are constantly dividing and growing.
Because they need fuel.
Right. To build new cell membranes, they need structural building blocks. And cholesterol is a primary building block.
Wait, really? Cholesterol?
Yes. So by having high lipids in the blood, the body is inadvertently exposing these rogue cells to excess cholesterol. Furthermore, That chronic inflammation actually helps stabilize the vascular network like the blood supply that the tumor needs to feed itself.
Oh, wow. So the body's internal environment is inadvertently laying down the red carpet and basically offering up a buffet for the cancer to return.
That's a grim way to look at it, but physiologically, yes.
That is terrifying. But I guess it also creates a very clear target. If the environment is toxic, the logical next step is figuring out how to dismantle it. And that is where the combined aerobic and resistance training, the CART, comes in.
Yeah.
We're talking about running, cycling, or swimming paired with lifting weights.
A dual approach.
Yeah. So the meta-analysis looked at the primary physical outcomes of this exercise, and we see some really profound shifts in the data. The researchers didn't just see a marginal drop,
No, the drops were substantial.
right? They saw massive, statistically significant reductions in body mass index. Body fat percentage went down, total fat mass shrank, even hip circumference reduced significantly.
And we aren't talking about decimal points of change that only a scientist cares about here.
Yeah.
We're talking about tangible structural changes to the body's composition. And those tangible reductions are happening in the exact tissue that is causing that systemic inflammation we just talked about.
The rogue factory is being dismantled.
Exactly. The aerobic component is burning calories and forcing cardiovascular efficiency, while the resistance
Very active.
highly active. By combining them, you're applying a potent two-pronged stimulus for altering body composition.
But wait, here is a finding in the data that genuinely made me do a double take.
Oh, which one?
So despite those drops in fat mass and hip circumference, there was no significant difference in overall body weight between the exercise group and the control group.
Ah, yes. The body weight paradox.
Yeah. Waist circumference and waist to hip ratio didn't move significantly either. If the fat is leaving the body, why isn't the scale moving? I mean, it feels completely contradictory.
It does seem that way at first glance.
Right. I was thinking about it like a house remodeling project.
Right.
If you don't change the exterior footprint of the house, which, would be your total body weight, it might look exactly the same from the outside.
Right.
But inside, you've knocked down walls, replaced old plumbing, and completely changed the interior structure. You've swapped out the inflammatory tissue for structurally sound, dense muscle.
That structural analogy is incredibly apt because muscle tissue is significantly denser than adipose tissue.
Okay, so it takes up less space.
Right. You can lose a considerable volume of fat, and if you replace it with a smaller, heavier volume of muscle, your overall weight on a standard scale will remain completely static.
Wow.
The square footage is the same, but the materials have changed. However, when you look closely at the data in this meta-analysis, there's a highly counterintuitive detail regarding fat-free mass, or FFM.
Oh, I saw this too.
Yeah, the standard treatment group, so the control group that was not doing the combined exercise intervention, they actually showed a greater increase in fat-free mass than the CART group.
Wait, I'm sorry, what? The people who were specifically not exercising gained more fat-free mass?
Yes.
How does that even make sense from a physiological standpoint?
Well, it doesn't. Not if you assume that fat-free mass automatically equals healthy muscle.
Oh, I see.
This raises an important question about the complexities of analyzing standard cancer treatments and why we have to read meta-analyses critically.
So what's actually happening there?
When you see a strange anomaly like this, you can't just take the data point at face value. You have to look at the context of the patients. The control groups are receiving standard medical care for breast cancer.
Right.
Depending on the exact pharmacological treatments involved across these 17 different trials, patients frequently experience side effects like severe fluid retention or lymphedema, which is localized swelling.
Oh, wow. Yeah.
Yeah. And bioelectrical impedance scales and other body composition tools often misinterpret that extra fluid weight as fat-free mass.
Oh, that makes so much sense. The scale doesn't know the difference between dense, newly built bicep muscle and medication-induced swelling.
Exactly. It just measures what isn't fat.
So we really can't rely on just the physical, exterior, or even a basic body composition scan to tell us the whole story.
No, we have to look deeper.
Right. If the physical interior of the house is being remodeled, let's look at the microscopic level. What is happening in the bloodstream as a direct result of that fat loss?
The biochemical shifts are arguably the most important part.
Yeah, because if the tumors need that cholesterol buffet we mentioned earlier, does the exercise actually shut the buffet down?
It absolutely does. And the secondary outcomes in this paper track this meticulously.
Okay, let's hear it.
Let's look at lipid metabolism. The combined training caused significant increases in high-density lipoprotein cholesterol, HDLC, the good cholesterol.
Right, we like HDL.
But more importantly, triglycerides absolutely plummeted. We're talking an average drop of almost 82 milligrams per deciliter.
82? Wait, really?
Yes, 81.90 to be exact. To put that magnitude in perspective, that is the kind of plunge you usually only see when a doctor puts a patient on aggressive lipid-lowering medication.
Wow. From just exercise.
Just exercise. Total cholesterol also saw a significant reduction. Now,
Yeah.
interestingly, LDL-C, the bad cholesterol, didn't significantly change, but the overall ratio and lipid profile drastically improved.
But how exactly is the exercise doing that? If I go lift some weights and ride a stationary bike, how does that translate to pulling 80 points of triglycerides out of my bloodstream?
It comes down to cellular adaptation. Exercise essentially forces the skeletal muscle to become highly efficient engines.
Okay.
During intense combined training, the body can't rely solely on stored glycogen for energy. It starts demanding lipids.
It needs more fuel.
Exactly. It improves the muscle's metabolic flexibility, allowing it to pull fats directly from the bloodstream to burn as fuel.
Oh, I see.
By burning those lipids, the exercise is actively clearing the serum. Remember how we said tumors rely on that hyperlipidemic environment?
The buffet?
Right. By forcing your muscles to consume those lipids, you are effectively starving the tumor cells of the building blocks they need to grow.
You're systematically cutting off the supply lines to the enemy.
That's a great way to put it.
Okay, so if the muscles are burning up the lipids to power this new workout routine, the tumor loses its food supply. But tumors also rely on that chaotic, inflamed environment, right? Those distressed text messages.
Yes, the adipokines.
Does fixing the lipid problem also calm down that chaos so that tumors can't hide from the immune system?
We see very clear evidence that it does. Tumor necrosis factor alpha, or TNF-alpha, which is a major inflammatory marker, significantly decreased in the exercise groups.
That's huge.
It is. Leptin, which is an adipokine strongly associated with obesity and increased breast cancer risk, also dropped significantly.
Okay.
Now, for the sake of scientific balance, I should note that other markers like IL-6, IL-8, C-reactive protein, and adiponectin showed no meaningful changes.
So it's not a magic bullet.
Right. It doesn't fix every single blood marker overnight. But the definitive decreases in TNF-alpha and leptin are crucial victories for changing that microenvironment.
Well, here's where it gets really interesting for me, because the study didn't just measure inflammation. It measured the immune system's active response, specifically natural killer cells, or NK cells.
Yes, a very important metric.
And in the exercise group, these natural killer cells saw a significant increase. So can you connect the dots for us here?
Absolutely.
How does dropping a specific inflammatory marker like TNF-alpha directly relate to having more of these natural killer cells circulating in the blood? Like, what's the actual mechanism there?
It is a beautifully interconnected mechanism. Natural killer cells are essentially the immune system's assassins.
I love that. Immune assassins.
They are uniquely designed to identify and destroy stressed cells, including tumor cells, without needing prior antibodies.
Okay.
But chronic inflammation, specifically high levels of TNF-alpha, creates sort of biological fog.
A fog.
Yeah, it suppresses the immune system, making it much harder for NK cells to function or multiply.
Oh, wow.
By engaging in CART, you're reducing the volume of adipose tissue, which lowers the output of TNF-alpha. When that inflammatory fog lifts, the immune system is disinhibited.
So they can finally do their job.
Exactly. The natural killer cells can multiply and operate at peak efficiency. So you are weakening the tumor's environment by starving it of lipids, while simultaneously arming and multiplying the body's natural defense forces.
That is just incredible to visualize.
Yeah.
And you aren't just burning calories on a treadmill. You are orchestrating a microscopic war.
You really are.
You're literally rewriting your cellular environment. And obviously, this microscopic battle directly dictates how the patient actually feels on a day-to-day basis. Which brings us to the macroscopic impact.
Right, the human element.
Yeah, because beyond the blood markers, these women are trying to reclaim their daily lives. The study looked at cancer-related indicators, and the results were profound. We're talking about significant reductions in cancer-related fatigue, a massive drop in sleep disturbances, and like a sharp, measurable increase in overall quality of life scores.
If we connect this to the bigger picture, The psychological and physical toll of breast cancer and its treatments just cannot be overstated.
No, absolutely not.
The data shows that roughly 60% of breast cancer patients demonstrate major sleep problems.
Wow, 60%.
Yeah, and this is not just feeling a little groggy, it creates a devastating vicious cycle.
Right, because if you aren't sleeping, you wake up with crippling daytime fatigue. And that fatigue makes the idea of physical activity feel literally impossible, which then, exacerbates weight gain and body dissatisfaction.
Exactly.
And that, in turn, fuels depression and anxiety, which just further ruins whatever sleep you were getting. It's a total physiological and psychological trap.
It is, and this is exactly why combined aerobic and resistance training acts as such a crucial non-pharmacologic adjunct therapy. It breaks the trap.
How so?
Well, when these patients engage in CART, they're reducing that systemic inflammation. High levels of inflammatory cytokines are actually known to directly cross the blood-brain barrier and cause feelings of severe lethargy and sickness behavior.
Oh, I didn't realize they crossed the blood-brain barrier.
They do. So by lowering that inflammation through exercise, they directly experience less physical fatigue. When they are less fatigued and have exerted themselves physically, their sleep architecture physically improves.
Better sleep, better recovery.
Right. Deeper sleep repairs the brain and the body, improving their mental state. It replaces a vicious cycle with a virtuous one, which is key for long-term adherence to the exercise routine.
They start to actually feel human again, rather than just feeling like a patient.
Exactly.
But as much as we love these positive outcomes, I know we have to put our academic hats on and look at the scientific rigor.
Not important.
Yeah, because no study is perfect.
Yeah.
And we have to be honest about the limitations of the data we're looking at here.
That is essential. The researchers utilized the GRADE methodology to assess the quality of the evidence they gathered from these 17 trials.
Just to clarify for anyone unfamiliar, GRADE is essentially a system researchers use to rate their own confidence in the data, right? Like, they actively penalize the data for potential bias or noise.
Precisely. They look at the body of evidence and ask, how sure are we that the true effect lies close to our estimate? And in this case, despite all the positive trends, their confidence in the estimated effects ranged from very low to low.
Wow, okay. Very low to low confidence. If the physiological mechanisms are so sound, why is their confidence in the actual trial data so low?
It primarily comes down to study design issues across the whole pool of data. First, many of the individual trials had small sample sizes.
Okay, that makes sense.
Second, there were high risks of performance bias. In a drug trial, you can give someone a placebo pill. In an exercise trial, it's impossible to blind a participant.
Right.
If you're lifting weights or running on a treadmill versus receiving standard care. Furthermore, there was substantial heterogeneity.
Meaning the studies were all a bit different.
Exactly. The exact type, duration, and intensity of the exercise varied widely from study to study. One trial might use intense heavy lifting, while another uses light resistance bands. All of this introduces noise into the data, forcing researchers to downgrade their absolute confidence in the precise numerical outcomes.
That makes total sense. You can't exactly put a placebo barbell in someone's hands.
No, you cannot.
And you can't guarantee every gym session was identical. But within that messy data, there was a specific fascinating detail that popped out in their subgroup analysis.
The duration of the interventions.
Yes. When they looked at the timeline of the interventions and its effect on BMI, the trials that lasted 16 weeks or less showed more favorable effects on BMI than the trials that lasted longer than 16 weeks.
It's very counterintuitive.
Think about that. Shorter interventions yielded better numerical results than the longer ones. Why would that be? I mean, my first thought is just participant burnout. Does the novelty of a new workout routine just wear off after 4 months?
It's easy to assume that's just participant burnout, but we actually have to look at how these clinical trials are structured and supervised.
Oh.
In clinical exercise physiology, adherence is always the hardest variable to control. In a short 12 to 16-week window, you often have a researcher or a designated trainer breathing down your neck.
Right, you have accountability.
Supervision is usually very strict, motivation is artificially high, and adherence to both the exercise and likely unstated dietary restrictions is at its peak.
So they're on their best behavior.
Exactly. But as a trial drags on for 6 months or a year, that intense supervision fades. Life gets in the way. The psychological burden of maintaining a rigorous routine while managing the long-term aftermath of cancer treatment becomes incredibly heavy.
That makes a lot of sense.
This is why the study concludes that while CART is an effective adjunct therapy, we desperately need larger, higher quality, long-term randomized controlled trials. We need to figure out the exact optimal dose, the right frequency, intensity, and time that maximizes these cellular benefits without causing that behavioral drop-off.
Thinking about that 16-week drop-off for you listening,
Yeah.
what stands out to you about human motivation and exercise adherence when facing a chronic illness?
It's a tough question.
It is, because it's one thing to know the science in a vacuum. It's another thing entirely to wake up fighting lingering cancer-related fatigue and choose to pick up the weights. It requires a monumental amount of willpower.
It does. But understanding these exact mechanisms, knowing that you are actively starving the tumor microenvironment and deploying natural killer cells, might be the cognitive tool some patients need to push through that daily friction.
Yeah. So what does this all mean? We started this deep dive talking about this tendency to view body fat as just an inactive storage attic.
And we thoroughly debunked that.
Right. We've seen today that it's an active inflammatory environment. But more importantly, we've seen that we have a definitive mechanism to dismantle it. It challenges us to completely rethink how we traditionally view exercise.
Absolutely.
We're so conditioned to view the treadmill and the dumbbells merely as tools for weight loss. If the scale doesn't move, we assume the exercise isn't working. But this paper proves that is a dangerous misconception. Exercise is quite literally a cellular prescription.
A targeted intervention.
Yeah, it's a targeted intervention for rewriting your internal environment, boosting your immune assassins, shutting down lipid supply lines, and making your body inhospitable to cancer, even if the overall number on the scale never changes by a single pound.
And it brings up a fascinating paradigm shift for the future of oncology and metabolic health. If CART is this measurably effective on a cellular level, we have to start viewing it with the same clinical seriousness as pharmacology.
Exactly. It brings up a wild thought for the future of medicine, like at what point do oncologists stop merely recommending exercise and start legally prescribing it?
That would change everything.
Imagine a world where your health insurance is required to cover a personal trainer and a gym membership with the exact same urgency and financial backing they use to cover chemotherapy or lipid-lowering drugs.
Because the data supports it.
Right. If the cellular result is a starved tumor and a mobilized immune system, the gym membership is a medical necessity, not a lifestyle choice.
That is the ultimate application of this data, shifting the narrative from aesthetic wellness to foundational metabolic survival.
It really does change everything. If you found this intersection of exercise physiology and oncology as fascinating as we did, we strongly encourage you to read the full systematic review for yourself.
Highly recommend it.
Yeah, look up the paper by Al-Mhanna et al., published in the Journal of Sports Science and Medicine, and explore their methodology and that subgroup data directly.
It is a profound piece of literature that encourages vital, critical thinking.
It really is. Please remember to follow the channel and turn on your notifications so you never miss another rigorous, accessible, scientific deep dive with us. Because the next time you look at a set of weights, I hope you don't just see a chore.
Or a means to lose weight.
Exactly. I hope you see a microscopic demolition crew ready to tear down that toxic environment one rep at a time. Until next time, keep digging.